So welcome and thanks for coming to our planning for prom presentation. We just wanted to take time to give you some information about sort of the current lay of the land with youth and substance use and give you some tips and allow some time for conversation around how to talk to your child and planning for their prom experiences that are coming up. I'll go back. I'm Lauren Nichols. I'm the school health professional at East High School. I'm there full time. So I do all things prevention and intervention around substance use at East. And I'll allow Maria, my counterpart at some other high schools, to introduce herself.
Yes, I'm Maria Height, and I'm the school health professional for Northeast Early College and also Abraham Lincoln, doing that same role related to substance education, therapies in sessions related to helping students, supporting students in limiting use, and also helping provide support to the community and understanding substance education in that sense too.
And Iram, do you want to introduce yourself?
My name is Iram Abdullah. I am a dean of students at East High School.
And then I won't make her introduce herself because she's on her lunch, but we also have with us Leah Rafa, who is our supervisor, there she is, at the district for all things school health professional and prevention. Did I miss anything, Leah? Okay, perfect. So I will let Maria talk a little bit about what are we going to cover today, and then we'll dive in.
Yeah, and so today's agenda is first we're going to discuss like current use, some of the perceptions of it, and statistics to go along with it. And also we'll discuss like why adolescents are more at risk comparative to like adults, for example, and then also what are the signs of looking for substance use in your child and what that might look like and manifest as. And then also what are some of the expectations surrounding substance use, what happens when things happen at school or interrelated to events at school. And then lastly, helping you as parents, guardians to plan successful conversations about your about talking to your adolescent about use and about substances.
Yeah, so diving in just to some statistics that we know. And so 90% of youth alcohol consumption happens in the form of binge drinking. That means typically 4 standard drinks for a biological female, 5 standard drinks for a biological male. And when I talk to students about this statistic, they're very shocked. I think the unfortunate reality is that I guess they're shocked of what is binge drinking, because the reality is that they say, yeah, people drink way more than that when they choose to drink. So it really doesn't take much to get people to that legal limit of 0.08 of intoxication. It's much less than what kids think and realize. And so it's important to know that if your child is drinking, it's usually with the intention of getting drunk.
And so perception of risk has increased significantly in the last few years. We can identify that 38.7% of Denver teens think there is no to slight risk when using marijuana regularly. And then also 18.7% of Denver teens used alcohol in the past month. And then 12% of Denver teens use marijuana in the past month. And then lastly, 12% of students have rode in a vehicle with a driver who was under the influence. And so discussing that change in perception of risk has grown significantly. 2 years ago, it was 59% thought there was no to slight risk.
I like to think that means our jobs are working, hopefully. But I think it's also so interesting that alcohol really does remain the #1 most used substance with teens. Oftentimes we think nowadays maybe it's vape pens or marijuana, but it really does continue to be alcohol.
And so 25.4% of students in DPS and vaped before the age of 13, and 22% of students in DPS do not think vaping daily is harmful. But in 2019, 30% of students did not think vaping was harmful. So another example of we think that our education is helping to change those perceptions.
So probably most of you here today are aware of why teens are at more risk, but some things that we really want teens to understand is where they're at developmentally and why it's different for them to use substances than an adult. So for number one, we know that the teen brain or your brain isn't really developed until the age of 25 to 30, with that last part of your brain to develop being that prefrontal system. So I always tell kids, they should have a hard time with impulsivity and time management and planning and prioritizing and organization, because naturally that should feel a little bit hard to them. But then what we have is their limbic system is really excitable right now. Risky things feel good, feel fun as a teenager. And so pairing that heightened limbic system with the prefrontal system still struggling to do its job, we really get this perfect storm for teens to be more at risk for substance abuse and for addiction. Their brains just simply grasp things, especially things that feel good, a lot quicker than a fully developed brain. And we're going to talk to you about some of the other risk factors that we look at for teens.
Yeah, and so some of those risks can be early age of first use can make an adolescent more prone to use continuously overall and become addicted. That risk can increase with early age of first drink. Also, family history of addiction can also increase risk too. But fortunately, there are protective factors that can help support students, like learning strong coping skills, clear expectations from family and adults around them. And then also creating and cultivating that sense of belonging, connection to the community can also help in protective ways, keeping students from less likely wanting to experiment with substances more seriously.
Yeah, and I think definitely hopefully helps keep that line of conversation open. I think teenagers are naturally curious, and there's a lot of sort of unsaid natural peer pressure when people around you are doing these things. And so we also like to talk to you about what are some warning signs that your student or child is potentially participating in substance use or really entrenched in substance use. And so we have individual behavioral and health risk factors. Sometimes these conversations can be awkward to have with your child. So we will, before we leave today, get into some tips on how to have that conversation, but that's what me and Maria are also there for as well. Your student can come speak with us if you want us to ask them about if they're doing okay, if they need any help or services, we can do that. And that information doesn't go to the deans or their teachers. It doesn't go on their academic record, as we really work to keep our services confidential and help students and families feel comfortable accessing us. And so we wanted to definitely take time. Sorry, I can't get this screen to switch. We wanted to take some time to talk about really what are the expectations around these types of events. With prom coming up, we see oftentimes a lot of alcohol use, sometimes other substance use, but there are certain things that the school is obligated to do. We always like to remind parents of laws, just so you can remind your student of what those laws really are, and then what are potential consequences. So I'm going to allow our dean at East Iram to sort of talk about what are some common situations that we see come up, some common questions, concerns, and scenarios.
Hi, everyone. So the school obligations are pretty simple. What we see the most are children who arrive to prom already intoxicated, sometimes heavily, sometimes not so heavy, followed closely by vaping and or marijuana usage. So as mandatory reporters, if we know that a kiddo is under the influence, our first thing is to make sure they're safe. So we bring them into the dean's office and we make phone calls home. We will keep calling until we reach a family member or a parent who can come and get the student. If not, depending on the level of the intoxication, we will have to call the paramedics, and your student can be taken to Denver Health. As far as punishment or consequences for this behavior at prom, suspension, the inability to attend any other school hosted events. And as far as parents go, no, of course, most parents are not hosting parties where their students will be drinking, but in the event that that happens, we do have the ability to call DPD and CHS. Of course, we don't want to do that. So the more you guys are involved and you can kind of monitor what your kiddos are doing before prom, it really helps us out on our end. Another, outside of suspension or in conjunction with suspension at times, we will refer students who are under the influence of marijuana or alcohol to our drug and alcohol counselor, which would be Miss Lauren Nichols.
Yeah, so we work really hard to provide restorative or diversion type services so that kids don't have those suspensions on their record long term. But if you are a parent of a senior, as I assume you are, that gets tricky when prom butts up so close to graduation. It can be difficult to provide the services that are necessary in a quick enough manner to get them off your student's record before they're done with East. And then a lot of times kids don't know if they get sent home from prom for intoxication, they can't return to prom and they can't then come to after prom. So some concerning, things there, things that they definitely have looked forward to and hopefully they can be at for the full time. And if you have any other questions about specific things in terms of the obligations or consequences, feel free to pop in the chat or pop on your mic. But we want you to know, okay, so what does this look like? What do we do? And so these are 6 tips that we utilize in our intervention program, Teen Intervene, just to help parents navigate sometimes these difficult conversations around, substance use and potentially other topics, but I'll walk you through them. So number 1, I care. This is where you're just expressing to your child, I care about you. I don't want you to see you get hurt. I see. This is where we work to be objective. Emotions can run really high in these types of situations, but maybe they came in and you're really tempted to just yell at them right then and there. But instead, maybe waiting till the next day and being really objective. When you came in, it was 3 a.m., your eyes were red and you smelled like alcohol. I feel worried about you. I listen. I'm here for you when you're ready to talk. We definitely recommend not engaging in that conversation while your child or you are under the influence, waiting until everyone is sober. And then this is what you want from them. And this could look a couple of different ways. Number 1, you could say, I want you to make an appointment with your school health professional. I want you to talk to Miss Lauren or Miss Maria tomorrow before prom so that you have a safe, confidential place to have a conversation about what your decisions are going to look like. This is maybe also I want in terms of you setting your expectations as a family of what are the expected boundaries and potential outcomes of those boundaries. And then what will you do? Will you follow up with your student? Will you help them find resources that feel good to them? Will you follow up with me and make sure they saw me? Will you provide predictable outcomes of those expectations, such as predictable consequences, so they know what they're getting into if they choose to abide by or not abide by your family's expectations. So all of those things are really just utilizing some of those motivational interviewing skills that we use with your student and can hopefully help set you up for a productive and successful conversation. And then I'm going to let Maria talk a little bit about some resources that we would recommend if you're worried about your child for mental health or substance use.
Here are some general resources that can be helpful in these types of situations. Like Second Wind Fund is a therapy for youth expressing suicidal thoughts and feelings, and they do up to 12 sessions free of cost. There's also Mental Health Center of Denver that takes a lot of our referrals. They are accessible community mental health, and they also provide a Spanish or a facility where community people who speak Spanish can also get therapy as well, and that's just below that mental health El Centro de las Familias. And then you might have already been familiar with Safe to Tell, but that is a 1-800 number that you can report, or someone can also express feelings of like an adolescent expressing concerns about their own health or others. And then the Denver Family Institute is a comprehensive individual, couples, and family therapy, and with a specialty in addiction. And then we have Sandstone, which is a dual diagnosis treatment agency, and they focus on family and integrative medicine. And then finally, Denver Health also provides a school-based health centers in some high schools and comprehensive care, as well as mental health and substance use treatments. They also have a STEP program to help students in supporting sobriety as well.
Perfect. Yeah. And then you can also always contact your insurance company to better understand your benefits. What does your insurance company cover in terms of these types of treatments? And they should also have a list of providers in your area that they partner with, or that in your network. So we wanted to keep that part brief. And if you all have any questions, thoughts, or concerns, we're happy to chat through different scenarios with you. Our contact information is on the screen as well. Again, I am at East High School. And Maria, will you remind us of what high schools you're at?
Abraham Lincoln and Northeast Early College.
Perfect. So that's really all we have. A nice quick presentation. I don't know if you all have any questions. Thank you so much for coming, Wendy and Jennifer. We really appreciate it.